for people who maybe don't know you, why don't you tell us about your career path? How did you get into public health? What role did your faith play in discerning that process? Let's just kind of get up to this point where you're in this tremendously important leadership role in a huge crisis.
Thanks, Jordan. Great to be here, guys. I would say the story of my career really starts in childhood because, as you may or may not have noticed, I am Indian. And as you may or may not have noticed, there are a lot of Indians who are doctors in this country. And so, growing up, I think that in our family, it was just like kind of expected, right? It was either I was going to go into IT or going to medicine, and I chose medicine. And I would say, my parents were pretty savvy about that. Like, they were not heavy-handed in any way. They weren't like, you got to go to med school. Neither of them are doctors. But whatever they did worked, because I ended up in med school, and my brother, who is 3.5 years younger than me, is also in med school. He married a delightful Indian woman who is also a physician, and they've got 4 Indian kids who will likely all be doctors someday. But so that, I think that like the cultural reality for Indians kind of started me on that path. I got to med school, and the third year of med school is when you start like actually doing your clinical rotations and experiencing, dermatology and OB and surgery. And like every month I was like, this is not what I want to do. And that was hard because I'd spent, my entire life and had sort of the momentum of family and expectation and all of that. And so that felt like a little bit of a crisis moment. I came home and told my wife that I had thought about quitting med school, and she was like, you got 1 more year. Like, let's just suck it up and finish and figure it out from there. And thankfully, it was great advice, because what that led to was my 4th year of med school really being proactive and intentional about exploring, like, what do you do if you're a physician that doesn't want to do, like, real doctoring? And so my wife and I went and did a month in East Africa, and I worked for a CEO of a hospital, just learning, the administrative side of medicine for a month. And then I did a month at the state health department and local health department, and it was my first exposure to this whole field called public health, which I feel like now is in everybody's consciousness, but like nobody knew about back then. And so it was fundamentally, the difference was, instead of thinking about health in the individual doctor-patient relationship, public health thinks about health from the macro. Like, what is it about the environment or culture or behavior that drive health outcomes at a macro level? And that was the stuff. I just got so fired up about that. I think my desire to try to impact health at that scale, largely because it was rooted in these threads of justice that were becoming really important to me as a Christian. I think in my sort of college days and beyond, having exposure to some of the injustices of our country's history and reality of disparities in community. And why is it that Black infant mortality rates are 2 to 3 times as high as white infant mortality rates? Like, those were the questions that were really starting to become interesting to me. So that's how I found public health. And as you can hear, like, I got into public health not at all thinking that I would someday have to manage a pandemic. The communicable disease side of this was not at all of interest. And so I spent, 12 years as a local public health doc, really doing the other stuff: chronic disease, health disparities, health system work. And then 2020 happened.
Before we get into 2020, it strikes me that when people think about you and your career now or in the future, if somebody pulls up your resume, they're probably going to almost ignore that first 12 years, right? Your story will jump out at them for 2020 and maybe beyond. And I think many of us in our careers have that experience where the hard work and the preparatory work, the good and faithful work, gets overlooked for the big thing or the crisis moment. How did those prior 12 years maybe shape and form you and prepare you for something that was impossible to prepare for?
Mm-hmm. Well, I would say like the technical part of the answer is that while we had never experienced anything like COVID, part of local public health and sort of our governmental public health's function in society is to navigate through emergent public health disease, right? And we've had some of that, even in the last 12 years, learning to navigate through Zika or Ebola or H1N1, right? There were different types of emerging public health threats that on a much smaller scale, we actually had to develop responses to, right? Like, how do you ensure that the community is coordinated enough that when, I remember one of the early patients of concern with Ebola was right here in Richmond, and it was somebody who had showed up off of a Greyhound bus, and they ended up in Crossover Medical Center's waiting room. And so I got a call from the medical director there, saying, "Hey, we've got this patient. They just flew in from Africa." And within an hour, like people in the waiting room got wind of it and were calling the media, and so like media trucks were showing up outside of the health clinic. So that, among lots of other examples, we drill, we do emergency preparedness, we do mass vaccination clinics every year around flu to prepare for the events just like COVID. Now, again, never to the scale that COVID has become. But so there's a technical part of that answer, which is that the discipline of public health trains you for it. Sure. But then I think like the more relational, adaptive part of that answer is that public health is a field where you are solving really complex problems all the time, right? Like we think about something like childhood obesity, and at the individual level, it's not easy at all, but the answer is, modulate your dietary intake and exercise and, really focus on nutrition, and you can work through that at the individual level. But at the community level, you're facing all of these complex dynamics around family culture and processed foods and marketing of sugar-sweetened beverages and accessibility of foods and food deserts and all of those different things. And so everything that we try to solve in public health is this really complex mix of drivers. And so I'd say in some ways that's preparation for having to make decisions in an environment that's really ambiguous, and that there are lots of different things at play, and you don't always know what's going on, but you gotta kind of figure it out along the way.
Yeah, and it's so interesting to hear you talk about that God's heart for justice that you were learning about was part of your driver, because I think, for me anyway, when I think about healthcare and the roles that doctors and nurses and others play in our society, I can see the reflection of God as a healer. But the work that you're doing, dealing with more systemic and societal problems, that's really God's heart as the just Lord who wants to enact. So I want to come back to that, but that's fascinating. Any crisis that any of us face, we either are kind of shoved off a cliff and we don't have a choice, you're just careening down and you have to deal with it. But sometimes you're brought up to the precipice and you have that moment. So when Governor Northam reaches out to you, maybe he doesn't ask, I don't know, does he just tell you you're doing this? So what was that like? And did you have the opportunity to reflect, do I want to do this? Or is it just like, I don't have a choice, we're going, sorry family, I'll see you in 2 years. I mean, what was that experience like?
So I should share the lead up to that was that, COVID emerged in January, February 2020. So most of 2020, I was in the role as the local health director in Richmond and Henrico, and my daily job was really helping our team, helping the community navigate the disease, helping the local Richmond and Henrico community. And that was, there were different phases of that. At one point it was, responding to these acute outbreaks in nursing homes and assisted living facilities that were just devastating. It emerged to, what are we doing around school policy? How long are we actually going to keep kids out of school? How do we provide helpful guidance? What are the decisions about, should we wear a mask? Should we not wear a mask? Like, so all of that was just, and we can talk more of that if it's of interest, but it was after that in January of 2021, that the governor called and asked if I would be, he did ask, it's kind, if I'd be willing to come to the state and run the vaccination effort.
Yeah.
And, I think in my career, and I don't know if this is good advice or not, but I have always just walked through doors as they open, right? Like and my assistant hates me for it, but I just have this issue where like I say yes to everything. And I think it creates points of intersection, it creates learning opportunities, and it creates opportunities to do things that you never expected to be able to do. And so I did use a little bit of judgment. I talked to my wife first, and then I talked to the mayor and the county manager in Henrico, and just, and I think all of them were like, Danny, for such a time as this, this is, we will miss your leadership locally, but the state will be better off for it. And so I think having all of them just really affirm the decision to jump into this was really meaningful.
Yeah. So you just said, for such a time as this, right? So that comes from the biblical story of Esther, where God has positioned her into this leadership role to be his instrument to deliver his people. But that phrase gets said to her by her uncle in the context of, look, God is going to do what he's going to do to rescue these people anyway. But maybe if you don't step up, you will lose your chance to be part of it. God's going to do it with you or not. And I think there's an opportunity that all of us get where we can make that choice to step in or be fearful and step away or overthink it. Did you find that having said yes, were there ways that God affirmed that decision? Do you have any question in your mind? Was that the right decision? You may kind of sounds like maybe you're not a person that looks back. You look forward, right? But like, what was that process like?
Yeah.
Especially, I imagine it got exhausting and hard and complicated. Did you ever wonder, was this the right move?
That's a great question, Jordan. I'm not one who looks back. And I would say there are so many evidences of God's faithfulness, of our community's faithfulness in the process that, just like every week was a different affirmation, every day was a different affirmation of the decision. And it was a big one because like I really, none of us knew what we were doing, right? Like it was just such a space of uncertainty, of constantly evolving information, constantly changing information. And so we were stepping into this place of like having to be on the TV, on the firing line, held responsible to whatever degree people were going to hold me responsible. And that was a little frightening. And especially because, with the vaccine in particular, so little was known, like sort of going into that. And well, that was the perception of the community, right? And so, we can talk more about that, but I would say that, to your question, the constancy of, just people like writing me handwritten notes and just praying for me and sending me verses. And, we'd have to cook a meal for like 3 months. I mean, people were bringing food to our house every day. And it felt like this was a community of people stepping into this with us. That was incredible. I mean, it was just an incredible experience of God's faithfulness through the church and through our larger network of friends.
Well, and you had this unique situation of an incredibly complicated, that's such an understatement, but crisis, this maelstrom of a crisis, and all of the internal pressure, and I'm sure all of the external pressure, all of the reaction of the public, positive, but also negative. Yeah. How did you stay anchored how did your identity not become how the media is talking about me today, the criticism I got yesterday, the kind note I got 2 days ago? I mean, how did your identity not shatter in the crisis and yeah.
Yeah. I think, I had a boss when I was the deputy director of the health department, and who, and I worked with him for 5.5 years, and one of his constant refrains, and it was really as he was coaching me in terms of how we manage and lead other people, how we deliver hard news, how we work people through the disciplinary process. There has just been this constant, like, you are not your work, right? Like, this is not the substance of who you are. And so I think that was pretty well drilled into me. I also think by personality, I don't dwell on the past, and I don't like the hard stuff doesn't stick, and I really it's like great for my marriage in some ways because I don't remember hard things that just happened, but it also like frustrates my wife because she's like, wait, what, we just had this like monster fight about this thing, and you haven't learned anything from it. So I think that part of the way that I'm wired is really just to be focused on the positive. If there are Enneagram people out there, I'm a 7, and so I'm really focused on sort of the positive end of the emotional spectrum, and that has problems. But for things like this, it's great.
Would that we could all be healthy 7s. So what were some, were there, I imagine anybody that had been put in your position, the tremendously small group of people that could have done it well as you did, would have tried to do their best and with excellence. Were there any ways that you felt like as a follower of Jesus, I'm going to try to do this or lead this way or coach this team in a certain way? How did your faith impact how you navigated this thing? Because it's not like you had time to do it. I'm going to take a week and take a big step back and pray through the whole thing. I mean, you're on the go. So what did that look like?
Yeah. I mean, I don't know that this situation brought this out of me, but like I think the way that I've approached leadership from the first time that I had the opportunity to do it was really rooted in humility and this acknowledgement that like leadership is not about propping myself up or showing people what I know or why I'm good or like trying to define my worth or value through this position, but rather leadership is the opportunity to influence and to ask questions and to learn and ultimately to raise up a group of leaders who are actually going to get the work done. And so I think stepping into this role in January of 2021, there were clear ways that I had to be the one who was making decisions and being the one communicating those decisions. But like every day with my team, I was like, guys, I don't know. Like, I don't know what the answer is. And so a real reliance on the team and the people I was surrounded by and just being willing to listen and to change my mind when somebody else presented a better path. I would say I would like to think that that's been the hallmark of the way that I've led at the health department and in COVID and subsequently at social services. But I do think that coming to it with a humility and a transparency about, hey, like, I don't know that I did anything special to end up here. I am charged with the responsibility to make the decisions, but I can't do that without all of you.
And there's a real power in a leader who says, I don't know, and has the humility to offer that. When that's an invitation for people to then step in, but also to not feel like they have to be perfect either. So that's really powerful. All of us work in workplaces that have office politics, and you had politics surrounding your work. And we live in this society where unfortunately people are often at odds or polarized in different ways. Without getting into the partisan side of that, how did you navigate that? How did you kind of stay appropriately engaged or disengaged with that going on? Because people politically were weighing in on decisions you were having to make as the research was evolving and coming out. What did that look like for you?
Yeah. I mean, I don't think you can not get into the partisan part, right? Like that was such a, it was really exacerbated by our country's response to the pandemic, right? I think there have been things leading up to COVID that were further polarizing people politically. And the pandemic just laid another huge opportunity to throw darts at the other side. And, you know, I think in the role that I was playing, you know, my approach every day was like, be present, show up, and share as honestly and transparently as I can. And so, I remember the first like 2 to 3 months of the role. There were weeks I was working well over 100-hour weeks, and it's because like we were trying to figure out all of the operational side of vaccination during the day and making the decisions about who should be prioritized and where the vaccine should go. But every night I was doing town halls for legislators, for local government officials, for delegates and senators, regardless of what party they were from. But like they wanted to hear the information and they wanted their constituents to hear the information. And so just making sure that I was showing up for that, I think ultimately engendered a lot of appreciation regardless of the politics around this. And it was interesting because I think there were realities of the way that the pandemic played out that were perceived as really political. So for example, the early phase of the disease that really disproportionately impacted Black and Latino residents of communities. And us, really in Richmond and Henrico, really making efforts to increase access to testing in those communities and to elevate that data and help people understand that the reason that lower income minorities in this community were experiencing COVID at higher rates was because they were working frontline jobs where they weren't protected. They were relying on public transportation. They didn't have as ready access to healthcare, et cetera, et cetera. And so it was hard to shake that because that contributed to people feeling like, not wanting to hear what public health had to say or what I had to say. But the consistency of just like, I was doing media 5 days a week for the better part of 2 years. And just the willingness to show up and say, here's what we know, here's what we don't know. And to try to anchor that in data and science, but then also, share the experiences of people around the state. And it was really interesting to see that shift because there then became a time where the initial wave that impacted lower income minorities like post-vaccination really shifted to Southwest Virginia and rural parts of Virginia where it was vaccine hesitancy that was leading to much higher rates of disease and much higher rates of severe disease. Ballard Health System down in Southwest was one of the first to just be completely overwhelmed in Virginia. And so the impacted populations changed. And so therefore, like the focus and the populations that we were trying to like educate and talk to and convince to go a different way really changed. And so, I felt my approach was always like, this is not political, even though there's clearly politics happening, and I just needed to stay true to the science in whatever degree we. And one example of that was we worked really hard early on to get everybody to really commit to masks and to practices that were going to stem the transmission of disease. We then saw all of the data internationally in schools about how schools had actually effectively managed this. And so then I and a few other docs get on with the school board in Richmond City, and we're trying to share with them the data and say, you know what, this is, every decision on public health is a risk-benefit calculation, but what we've seen from the data is that it is more risky for kids to not be in school than it is for them to, continue doing this virtual thing. And we got vilified, right? We're like, all of a sudden, I was a super Trumper because of that, right? And so it just, like, I think people had so tightly clung to their perception of like what it was to be a good person for the public health versus, oh gosh.
Are we being played off stage? Just keep rolling. Can we?
Yeah.
Thanks, James.
Anyway, yeah, like I think that like original focus on making decisions for individuals versus making decisions for communities became the flashpoint for everything else related to COVID and politics.
I'm very distracted. I apologize. It's okay. Jeremy, just wave at me when it's time, by the way, because this is such a good conversation. I'm not at all paying attention at the time. So, so that's an example of those external pressures that people, regardless of how you and your team were choosing to navigate everything. Do we need to slow dance? I don't know what to do right now. regardless of how of what your motivations were or how you all were making decisions, people had a perception, which I think happens uniquely in the role that you were in. But I think that happens in an office. I think that happens in a workplace. People jump to conclusions. They make determinations about what you're doing and why. But it sounds like you were able to just sort of stay steady and just stay consistent. Was there anything, did your wife help you do that? Did friends, or again, does that kind of come back to who you kind of had grown into as a man?
Yeah. I think my training as a physician is one that really emphasizes being non-judgmental. Meaning that whatever patient walks into your clinic, you are going to treat them with dignity and respect and care. And certainly, our faith calls us to that. I think that the church does not get this right often, but we are to be a place of acceptance and safety for people. And so I think my training and my faith really probably informed that more than anything. And in the context of COVID, prior to COVID, a big thing that we would do in public health every year is try to increase vaccination rates, flu and otherwise. And what we historically see is that African-American communities have much lower vaccination rates. And there's a very legitimate reasons for that. Our country's public health history is filled with examples of where institutional health, governmental health have abused African-American populations, used them for experimentation, and really not treated the Black community with dignity. And that has led to a generational distrust of public health. And we see that in health behaviors, health access, at vaccination rates, preventive behaviors, et cetera. That was, what was interesting is that the politics of this really shifted because what we saw eventually was that we saw much lower acceptance of the vaccine in more rural, predominantly white communities. Yeah. And interestingly, as in talking to residents of Southwest Virginia and talking to healthcare providers and faith leaders, the recent history of Southwest Virginia informed that a lot, right? They think about Appalachia had just lived through this entire opioid epidemic. Right. And for the last few years, what has been coming to the surface is that the government basically rubber stamped opioids, which devastated these communities. Yeah. And so now they're seeing the same thing happen again, purportedly, with vaccine, right? The government is rubber stamping these vaccines, and why should I trust that? So I think, for me, in this role as a public health doc, as a believer, trying to enter every one of those conversations with a desire to say, where's this person coming from? Yeah. And really trying to understand that before casting any judgment or putting them in a box about how this conversation might end up.
That's really powerful. Man, I want to go down that trail. For the sake of time, I'm going to ask you one more question. I'm going to pivot, and then we'll have a time for the community to do a Q&A in a little bit. So you're not in that role anymore, and probably have lots of different opportunities that the Lord will put in front of you, doors to walk through in the future. Now that you're past, hopefully, the biggest public health crisis that any of us will live through, who knows, what lessons are you taking from that experience, or what things are you trying to apply now that you learned from that maybe any of us could apply in our own roles or places in life? What would you take from that experience other than, thank the Lord,
Yeah. I think that in leadership, so much of decision-making we have to do and leading people through things happens in a sort of context of ambiguity, right? We don't always have all the answers. And sometimes, in a non-pandemic context, we've got more time to gather information and to weigh possibilities. But the fact remains that we can't predict the future. And so the ability to acknowledge that and to rely on other people and to seek wisdom elsewhere. That's wisdom from other people, wisdom from my wife, wisdom from the Lord, the recognition that I can't come up with these answers on my own, but I'm really dependent on others to do this collectively. I mean, that's probably the biggest thing in the midst of crisis, and now in a similarly complicated but not as acute crisis job. But yeah, I mean, that feels like, yeah.
Yeah. Well, Danny, thank you for being willing to get up and share with us. But I also want to say, probably on behalf of everybody, it was when I heard on the news that you were going to be stepping into that role, and I really mostly knew you by reputation at that point, but to know that a man of character and excellence and faith was stepping into that was a huge gift as the rest of us lived through what you worked through. And so I just thank God that he put you in that position and that you led with humility and faithfulness. So thank you for doing that. Thank you for speaking.
Thank you, Jordan. Thank you, guys.